Good morning, good afternoon, good evening, everyone. Welcome to International Medical Corps' briefing to discuss the aftermath of the devastating earthquakes that hit the Republic of Turkey and Syria almost 2 months ago. I'm Rebecca Milner, International Medical Corps' Chief Advancement Officer, and I'm delighted that you've all taken the time out of your schedules to join us today. Many of you on this call have generously supported our work over the years, and in particular, this response. And we are incredibly grateful for your trust and your commitment. In fact, your support makes our work possible. So thank you. Thank you very much. We're going to keep today's briefing as efficient as possible. We'll wrap up in about 45 minutes. Toward the end of our conversation, we'll take a few questions. So as we talk, please feel free to type your questions in the Zoom Q&A, and we'll do our best to get to them. I'm sure you all remember just how devastating the series of earthquakes that began in February were. I want to ask Catherine to put up a map. I want to share a map quickly so that you can visualize the size and the scale of the destruction. As we all know, it started with two massive earthquakes, one 7.8 and one 7.5 magnitude on February 6th, followed by thousands of really strong aftershocks. More than 50,000 people in Turkey and Syria died, with tens of thousands more injured as a result. And as you can see, the severe impact, the dark red areas of the earthquake covered an incredibly wide geographic area. And as we know, the epicenter was Gaziantep. According to preliminary assessments in Turkey, only 1 in 7 family healthcare centers in the most affected areas are functional, leaving thousands without access to essential health services. The situation in Syria is also dire. Before the earthquake, some 15 million people were already in need of humanitarian assistance. As you know, 12 years of war has decimated essential public services and limited access to health support for thousands of households across the country. In 2022, the UN reported that only 59% of hospitals and 57% of primary healthcare facilities were functioning. The earthquake resulted in further collapse of these essential services. Of course, the war has also complicated relief efforts. So, you know, in this context, under this context, I'm very happy to welcome 3 of our colleagues who responded in the immediate aftermath of the earthquakes. They will share their firsthand accounts of what the situation on the ground has looked like up until now, and what they anticipate will be needed as our response continues. From Syria, we have our country director, Wafa Sadek. Wafa has been leading our work in Syria for the last 8 years, and her leadership has made a tremendous difference in Syria, and we are really fortunate to have you on our team, Wafa. We also have our Syria-based medical coordinator, Dr. Zara Shah, with us today. Zara led a number of our early assessments to the affected areas. And lastly, but not least, we have Anil Kangal, a member of our emergency response team that responded in Turkey. We are trying to be very respectful of the new name of Turkey, Turkey. And so Anil and I will try to get that right. But if we occasionally lapse into Turkey, that's what's happening there. Anil's regular day job is as our deputy director of programs in Lebanon. But she is originally from Turkey and has worked on humanitarian issues in the region for nearly 10 years, and was one of our first members of our team to raise her hand and say, I want to go. So welcome to you all. And as always, you know, thank you so much for the work that you do. Anil, let's start with you. You immediately deployed to Gaziantep. Tell us a little bit about what you saw.
Thank you, Rebecca. First of all, I would like to acknowledge and thank all the generous support from our donors who are a part of the call today. With their support, we have addressed the urgent needs of thousands of people who are directly impacted by these earthquakes. This is being said, I am originally based in Beirut, Lebanon, and in the early hours of February 6, we woke up feeling the first earthquake. It was felt pretty strong in Lebanon as well. when I realized this epicenter is actually in Turkey, my hometown, with a magnitude of 7.8, which is unprecedented in the recent history, I immediately called my family and loved ones to check on them. And the next morning, I was on a plane being deployed to Turkey. I have to say, this is one of the largest such disaster that hit the country in the last century. When I arrived to Turkey, what struck me the most was the scope and the magnitude of the devastation. The things I have witnessed were very heavy to digest personally. Some of the cities are completely destroyed. Walking through the streets, every building is just rubble. And we are talking about an area roughly the half of the UK in terms of its size, which is home to 14 million people, including 1.7 million Syrian refugees. Thousands of buildings were crumbled to dust. There were thousands of people still trapped under the rubble. Infrastructure was completely gone. Phone lines, internet, electricity, water networks were not working. And regular aftershocks were feeding into the overall panic of the people. And on top of it, the weather conditions were very harsh. People were just waiting outside their collapsed houses with the hope that search and rescue teams will find their loved ones. Turkish government immediately declared a level 4 emergency, leading to a call for international assistance, and governments around the world were quick to respond by deploying rescue teams. But in general, there was an overall shock and numbness among the people I met because the destruction was beyond anyone's apprehension, including mine.
Mm-hmm. Well, I mean, can you tell us a little bit about some of the stories that you heard, maybe, from the people that you spoke to?
I mean, unfortunately, in the first couple of days, the response coordinated was quite slow by the government. And I have met with people who have been waiting for days and trying to carve the rubble by their own bare hands, trying to reach out to their family members. Mm-hmm. I met with some Syrian refugees who came to Turkey, built their lives from scratch 10 years ago, and now they lost everything they have, no jobs, no security, nothing. So it was very heavy, actually. I mean, it's unfortunately very heavy.
Right. And now, 2 months later, sort of what's the situation on the ground? How has recovery progressed?
Unfortunately, 2 months later, the needs are on the ground still very dire, as the impact and the scope of the earthquakes are more visible. More than 50,000 people were died. Millions of people were injured or left homeless or lacking even the basic facilities. Turkish government declared a 3-month state of emergency for 11 provinces that have been most affected. And currently 2.4 million people are living in temporary settlements with bare minimum living conditions and limited or no access to any type of services. And people have lost family members, jobs, life savings, and their hopes for the future. But also, the entire interior infrastructure that goes with the local economy has been disrupted. Mm-hmm. Local shops, gas stations, public facilities like hospitals, schools, government buildings, and whole infrastructure is destroyed. World Bank estimates almost 34 billion US dollars in direct physical damages in Turkey, while the recovery and reconstruction costs will be probably very much larger. So unfortunately, it's just an overwhelming tragedy.
Mm-hmm. And it will take years for recovery.
Unfortunately.
Yeah. Well, Wafa, let's turn to Syria. Maybe you can talk a little bit about the impact across the region.
Yes, I mean, the impact in Syria was really frightful and shocking. I mean, Syria, as you mentioned, been going through a war, a devastating war for the last 12 years, where, as you mentioned, 50 million people are in need of humanitarian assistance. So this as well came on top of what's been happening, and the people are barely able to survive. The infrastructures in the country has been completely destroyed. There is no water, no electricity, and no fuel. And this is even before the earthquake. So it was really dreadful for the most of the population. People have lost their homes. And I mean, this is what they were like sort of clinging on. And many of them lost members of their families, obviously. And not only their families, their belongings, all their lives, like basically. And they came out of their homes basically with nothing, barefooted. They had nothing at all. And as mentioned by Anil, the weather was extremely harsh, very, very cold. It was freezing. You see children with barefooted, they didn't have anything. People were trying to find shelters to stay. Some of them, they actually stayed in the parks. Some of them in the cars. They just as well lacking all the sanitation facilities, which actually puts all the people in danger, especially women and girls, were actually lacking privacy, with high risk of GBV. And to add to the tragedy, all of it, it's actually the temperature, as I mentioned, mainly was less than -1, 2. So you could see the people lost hope completely. After this disaster years for the last 12 years. So it was really, really tragic.
Yeah. And Zara, you led an assessment team, a mobile medical team to Latakia, and assessing conditions, running the mobile medical team. Why don't you tell us a little bit about what you saw in those early days? You're on mute, Zara.
Hello, can you hear me?
Yes.
Thank you. So in the first 72 hours, about 3 trucks were sent to 3 of the most affected governorates, which was Hama, Aleppo, and Latakia. And whatever stock of medication we could spare, mostly primary healthcare medication, but also some emergency medication, was sent straight away to support local facilities. And I know from my colleagues on that first trip that when they arrived to the warehouses to supply the medication, they also saw trucks of dead bodies arriving at the same time. And these colleagues of ours needed quite a lot of support when they got back to Damascus with us. Like Anil said, I was also in Damascus when the first earthquake happened, and it was really rigorous, and we felt it in Damascus. The buildings were shaking. We ran out of the building, so I can't even imagine the impact for those who were closer to the epicenter. We quickly did our assessments, and within sort of the first 2 to 3 weeks, we decided to take some active mobile medical teams with supplies, intense supplies, so medication, but also ultrasound, equipment, everything we could get together to really provide support in the areas. And we chose Latakia because it was one of the highest impacted of the 3 governorates. Like you said, 15 million people in need. On top of that, with the earthquake, about 4 million were directly impacted. People were on the streets. We went to about 8 shelters to provide primary health and urgent health care. One of the shelters we were in, there were 2,000 people in one shelter and 2 bathrooms for all of them. And we had to wade through a river of urine to actually get to some people. And these are not generally unhygienic people. These are educated people who were living their lives as best as they could, given the circumstances, and were suddenly in this situation. So that's how I'll start, but welcoming questions.
Yeah. And Wafa, the conditions were just so horrible. Maybe you can tell us a story or two about some of the people that you met that were in.
Yeah, I actually as well visited just recently Aleppo and Hama. We are continuing. We visit on a regular basis those area, the affected area, Hama and Aleppo and Latakia. And I was visiting the main hospital. And the equipment and the situation is extremely bad. The public health in general, as you mentioned earlier, the hospitals and the primary health care, which actually belong to the Ministry of Health, it's really completely destroyed. Whatever left of it, the earthquake, it's gone. So we went to the hospital to see what we can support with and what we can help with. And basically, we saw a machine, CT scan. It's fit to be in the museum, to be quite honest. It's so bad. It is unbelievably, and obviously it's out of work. It doesn't work. And they told me they received over 100 patients just the first few hours of the earthquake. And the response was really, from them, they were overwhelmed because many hospitals is closed and they were the only one who's standing. So, and while I was talking to the director of the hospital, I saw a young lady. She was sitting with her grandfather. And the doctor told me that she was one of the victims of the earthquake. So I started talking to her. She's about 15 years old. And her father and her mother and her two siblings and their uncle who lives above them with his family as well. And the rest of the building, everybody in the building really died, all of them. And she was stuck for 20 hours under the rubble until she was saved. She thought that she's going to die. She will never make it. But I mean, the situation was extremely bad, as I mentioned, because of they've been surviving for the last 12 years with an extremely bad situation. And somebody asked, apparently a guy in Aleppo, and he said that if you ask about Syria, just tell whoever asks you that the people who survived died and the people who died survived. So it was very sad, very, very sad.
Right. Really difficult conditions across the region. I mean, maybe we can go back to you, Anil, and talk a little bit about our response strategy and the services that we are delivering kind of immediately in the aftermath, and then maybe talk a little bit about our plans longer term for recovery.
So since day one of the response, we have been on the ground with our local partners. We immediately mobilized and distributed thousands of drinking water, food baskets, nutrition packages for children, clothes, blankets, hygiene kits, mainly focusing in Gaziantep, Kahramanmaraş, and Hatay. We have been supporting the management of one of the central warehouses in Hatay, as there are a lot of humanitarian aid being donated, but the classification, organization, and distribution to remote locations is one of the biggest challenges at the moment. We have established water, sanitation, and hygiene facilities in 9 settlements. These include portable toilets, shower, toilets for persons with disabilities. And we have been distributing medical and assistive devices. We are in the process of currently final preparations to provide primary health care and mental health and psychosocial support services. And in the midterm to long term, we are also looking into physical rehabilitation as well.
Mm-hmm. So for these people that are in the shelters, I mean, how long do they anticipate being there? I mean, there's going to need to be some significant support across a significant period of time, right?
Exactly, and the problem is that even one month ago, there were floods in one of the impacted areas. So majority of the people who are living in the tents got directly impacted by it. And during the summer, some of these cities goes up to 45 degrees. So definitely longer term sustainable solutions needs to be found. President Erdogan stated that the construction of the buildings will be completed in 1 year, but we don't believe that this would be realistic. Mm-hmm. And there are still people who are living in the informal settlements, close to their damaged houses, in makeshift tents. So definitely, I mean, longer term, more permanent housing is a top priority at the moment.
Right, right. I mean, I'm sure it's similar in Syria. I mean, Wafa, maybe you can talk a little bit about what we've done to respond and then sort of some of our longer term recovery plans.
Yes, I mean, we were actually one of the first responders to the earthquake. As IMC, we, again, as Zahra mentioned, we were quickly able to donate. We did actually donated some medicine, medical consumable, even, I mean, cholera kits. Even now it's not there, but I mean, the weather is getting now better and it is very important. As you know, Syria as well was hit with the cholera. So now it might again come back, and we supported as well we donated NFI, like for the kids. We as it was very cold, we gave jackets, mattresses, blankets, LED lights because of the electricity. We did hygiene kits. I mean everything we could at that time be able to donate. We were trying to support them in the shelters. And then later on, as Zahra mentioned, we deployed an emergency team not only to assess the real need of the affected population, but also to provide emergency health and mental health to the affected population. We also cared for pregnant women and lactating mothers. Likewise, we supported taking care as well of the traumatic ones, including facilitating referrals for high level of care. And I mean, the needs is immense and require a lot of funding and support from everyone. And that's what we actually really need now. And we are on the ground, and whatever we can support with, we will be supporting, with this, basically.
Right. And Zara, maybe from a medical perspective, you can talk a little bit about what you're concerned about. I mean, kind of these emergencies within emergencies, right? And talk a little bit about what you think is going to happen in the coming weeks.
So I think as much as this is a clinical emergency, as Wafa mentioned, this is a mental health emergency as well. And the impact is really going to sort of last. From the purely clinical and traumatic perspective, we saw multiple patients with major trauma injuries in the hospitals. I specifically remember a 5-year-old boy who lost his whole family under the rubble. And because of the pressure on both his legs, they had to do a cut across both the legs. It's called a fasciotomy, where you release the pressure to save the limbs. So this little boy was just lying in the hospital with no family left, with limbs he couldn't really use. These sort of patients are going to need multiple plastic surgery reconstruction over the next sort of year, at least, to make them mobile again. So in line with that, one of the things IMC Syria has done is pledged and working on supporting an operating theatre in Latakia to improve their reconstruction surgical capacity and provide walking aids. So that's the traumatic part of it. The other part of it is that most of these people, in fact, all of these people, have no access left to primary health care. So if, let's say, you're on blood pressure medication, you're on thyroid medication, you've lost all of it, and you've lost access to the doctors because you're living far away and the health centers have collapsed. So one of the long-term needs will be access to primary healthcare medicine. The way IMC Syria is going to support this is we're sending a mobile medical team equipped with internal doctors, gynecologists, pediatricians, healthcare educators, and mental health support, psychosocial support as well, once a week to each of these areas as required to bridge that gap, at least for the next 6 months. As Wafa said, the funding requirements are dire, and the more funding we get, the more we'll be able to do. But that's a specific gap that we're trying to bridge. And IMC Syria actually specializes in primary healthcare needs, so that's something we can really support with. From the mental health, sorry, please.
Oh, I was just going to say one more thing on the, what about infectious disease outbreaks? I mean, Wafa mentioned cholera.
Absolutely. So cholera hit us in August last year. As the weather got better, the numbers of cases got better. As the weather gets more warm, as Wafa said, we are expecting the cholera outbreak to resurge. And as I said, when you have 2,000 people in a shelter, you're expecting the wash needs to be dire. Not just cholera, we're expecting other waterborne diseases to follow. So the need for water sanitation, hygiene is probably at the highest level. Awareness, health education, preventive healthcare strategies, and providing a dignified space for the IDPs to live to prevent these diseases. But we are expecting it to rise in the next couple of months, and we are planning to distribute multiple cholera kits and continue health education to impact behavior change as much as we can over the next couple of months.
Right. Okay, well, but let's then talk about the mental health emergency on both sides. I mean, maybe Zara, you can start, and Wafa and Anil, please jump in.
So from a mental health perspective, there's the counseling and the psychosocial support, but people also need mental health medication. This is a population that already has a lot of trauma, a lot of PTSD. So one of the things IMC Syria did when we got to this area was take mental health medication with us. And one of the plans, Wafa can talk more about this, is a mental health family center to be put up in one of these areas to provide sustainable long-term impact, and perhaps look into telemedicine support with mental health, but that has to be a sustainable long-term impact, which will require a lot of funding. But it's as important as the clinical work that we need to do.
Wafa, do you have anything to add to that?
Yeah, I mean, the community center, I mean, we already have identified a building, a place where we can start the community center in Hama. We were trying to find a place in Aleppo. Unfortunately, with the situation, as I mentioned, there are not many buildings around to be able to get
Hard
what
to
we want.
imagine, right?
Yeah, so
Hard to
basically,
imagine, right?
yeah, it is. Yeah. So Hama is now at the moment we found a space for a good community center where we can actually start our activities, where we already have like a little office there because we were already in Hama before the crisis. So, I mean, before the earthquake. So now most likely we will do that where we will have activities for the children's and the mothers and which hopefully we will be able to start it within 2 months because you really need to get approval, you need to get everything set. So basically hopefully we will be able to do it within 2 months, and we are really all of us looking forward for that. But I just want to add as well, I mean, we don't want to forget our health workers because they are equally affected by the earthquake. Most of our staff, they have families in Aleppo or in Latakia or in Hama where they lost members of their families and they are burnt out completely, again due to the heavy workload and the poor economy, the economic situation, the fluctuation of the dollars, where even this, they can't afford sometimes to do anything basically. So we are trying, at the moment even to look after our health worker, and we are trying to support the public health to make sure that they are aware of the health worker themselves if they need any support, and we are there for them.
Right. I mean, that's true across NGOs like International Medical Corps, but all of the health authorities, the health centers. I mean, people were personally impacted by this. So not
Absolutely.
only are they first, responding to the crisis, but dealing with their own personal crisis, and so that's doubly challenging.
Yes.
Our hearts go out to our colleagues in Syria. Anil, I mean, maybe you could talk a little bit about our longer term recovery efforts and the mental health piece of the work.
Maybe as just briefly mentioned, I mean, currently even in the longer term, one of the main needs will be the housing. Rebuilding and reconstruction efforts will take time, and in the short term, there are enormous needs in terms of shelter and basic necessities. Millions of people are currently living in temporary settlements in tent cities with poor living conditions and limited access to services. So people need assistance with basic household items even. On the other hand, lack of access to clean water, sanitation and hygiene facilities is a big problem in many camps, particularly in informal settlements. Latrine and shower units are needed in majority of the settlements. In case not addressed, this can lead to poor health outcomes and even spread of diseases. And lastly, but not leastly, obviously, the mental health, providing support to people who have experienced trauma, including counseling and mental health services, is very important. The earthquakes will have a deep psychological impact, and long-term support to recover from trauma will be definitely needed. And as Wafa mentioned, I think it's very, very important to highlight that it's not only for the people directly impacted from the earthquake, but also the service providers on the ground, because they are prone to secondary level of trauma at the moment, because even in Turkey at the moment, there's not even one person who is not directly or indirectly impacted from the earthquake itself.
Mm-hmm, mm-hmm, mm-hmm. Well, I would want to encourage anyone that's listening in. If you have any questions, please enter those into the chat. I mean, Wafa, you talked a little bit about some of our plans, but overall, on the recovery side, I mean, what do you think is needed? I mean, how are we looking at 6 to 12 months down the road?
I would say, I mean, I can summarize probably the needs within 3 points for the next 6 months. First of all, we really need to increase the health due to the sort of wound infection, the diseases, the cholera, the COVID, and maybe hepatitis A now is actually now surfing basically in Syria. And again, we really need to get talk about the vaccine preventable diseases and the healthcare disruption for patients with the chronic diseases and pregnant women and lactating mothers as well. And the second point I would say is the mental health and the psychosocial needs from the earthquake and for the earthquake survivors, including depression or post-traumatic stress disorder. And the third thing I would say, the children malnutrition, what we have seen when we visited recently, some areas, I mean, the malnutrition is terrible. I mean, the mothers, pregnant women who are really and their last months, they completely malnutrition is really bad. So again, I mean, what do you expect when she have the baby? Obviously, the baby will come again with malnutrition problems, and the poor living condition and the lack of adequate water, and for you know the which actually bring waterborne diseases. So this is probably 3 points I would say. But honestly, I have very big concern about the situation in Syria. The image at the moment is extremely gloomy. As mentioned as well before, the situation is extremely bad because of the war, and the funding is getting worse, and the people in need becoming countless before the earthquake. So the number now is, as mentioned, is over 15 million now. It's from UN OCHA. And now after the earthquake, situation obviously got worse, and people don't have home. They are living in shelters, some of them on the street. We really need more the support, whatever we can at the moment. Everybody needs support. So just to help this affected population.
Yeah. I mean, Zara, I mean, is there anything that you think we've missed that it's important for the audience to really know and think about?
I think I wouldn't want to sort of bring politics into this discussion, but there's been a war, and that comes with limitations to what can be brought into the country. And specifically, as a medical coordinator, my concerns are that the medication we need in the country doesn't exist. So, for example, when we talk about anti-epileptic drugs, or we talk about, as Wafa said, wound infection, we have very limited medications that we actually can use. Because of the political scenario, the scenario across the world, there are limitations to what can enter Syria. And I would just, want all of us to reflect on what that means for the person living inside Syria who just needs a medication but can't get it, but anyone who's not in the country can. And I think that's an important point for all of us to reflect on in terms of access to medication.
That's a good point. Yeah. I mean, I think it's hard for people to understand those limitations in our ability to get essential supplies into Syria. But it's a real barrier, and it impacts people's daily life. It's really challenging. So, Anil, is there anything that you think that the audience should keep in mind?
I mean, I would like to highlight that this is not a short-term response. Reconstruction and recovery efforts will take years, and it will take some time before people start feeling the normalcy again in these impacted areas. Some of the cities would need to be built from scratch with very careful planning, because the areas are, again, prone to earthquakes. The short, mid, and long-term needs are very dire, and we definitely need your support.
Thank you. I mean, it is very difficult conditions, but I hope there are glimmers of hope. I mean, Anil, I mean, what does give you hope? I mean, is there anything that you feel is?
I mean, I have started working with International Medical Corps in Gaziantep, Turkey, almost 10 years ago. So, which is one of the earthquake-impacted cities. So the earthquake response is quite personal to me. I have known the cities. I have lived and worked in some of them. I have loved ones in all of the region. But on the other hand, I have witnessed the extraordinary hospitality and kindness of my fellow citizens. So within these catastrophic times, any support, even little, makes me feel like I'm paying back.
Yeah, that's nice. That's nice. What do you think, Zara? Is there anything that gives you hope there?
Yes, absolutely. I think, as you heard from Wafa, I work with such a compassionate team, such compassionate seniors who really go the extra mile to support the doctors to do everything they need to do. IMC has such wonderful protocols and systems to make sure really everyone along the chain is trying to get what's needed where most needed. So I feel very hopeful and very inspired that we can really do something amazing that if we weren't there as IMC, it would not happen, it would not exist. So although the picture is very gloomy, I personally feel excited and exhilarated every day that we can support this.
Oh, that's good. What about you, Wafa? I know it's hard because you've lived through the war and
Yes.
led our efforts for so long, but do you see reason for hope?
I mean, yes, of course. I mean, without hope, we will never be able to survive, to be quite honest. But what gives me hope actually is the fact that every morning when I come to the office, I see the staff smiling despite what they've been through and despite what they have been, because they are regularly as well going to this area, the affected area, and they just want to go and they want to support. And some of them, as I said, they've lost members of their families, but they continue to work every morning with the most remote and vulnerable people and the most remote area, excuse me, with love and commitment and passion. I mean, I can see, to be quite honest, I can see the humanity through them. And that's what gives me a big, big hope.
Wow. Well, for those of you on the call that support our work, you can see what a difference it makes. And you can also see how we all feel about that support. And we just thank you so much for believing in International Medical Corps. Wafa, Zara, and Anil are all, examples of the incredible team members that we have across the 30 countries that we work in. And I just want to say thank you so much to you, Wafa, Anil, and Zara, for sharing your experiences with our supporters and giving everyone a sense of that while conditions are incredibly grim, there is progress on a daily basis. And so for those of you who are investors in International Medical Corps, you really are making a difference. So thank you very much, and appreciate everybody's incredible work. So thank you. And we'll sign off now, and thank you all for joining us today.
Thank you. Thank you very much.
Thank you very much.